I'm very concerned at this point.
Concerned about her 66-year-old brother with cerebral palsy, Cheryl Davis says he had COVID months ago, lost a lot of weight, and hasn't been the same since.
If my brother catches this again, it could take him out this time.
He's one of 1.3 million Americans living in a nursing home, according to the CDC. A report from the Centers for Medicare and Medicaid Services shows vaccination rates for staff and residents. The national average for residents, 84%, staff, 64%. President Biden recently announced a mandate that threatens to take away federal funds if workers aren't vaccinated. Details on that plan are being worked out now.
The Center for Medicare and Medicaid is very, very serious about staff at nursing homes being fully vaccinated and the residents.
News 3 Investigates found several local facilities on the report that were below the national average and a handful with only 20 to 30% of their staff vaccinated.
We're in the midst of a serious surge, and you don't want your elderly family members in a nursing home where the staff are not fully vaccinated.
EVMS professor of medicine Dr. Edward Oldfield was stunned by the numbers.
If I hadn't happened to go on that website, I would have no idea this was happening. I would have had the assumption that, of course, the staff are vaccinated and the residents are vaccinated. I would have had no idea that there was such variation.
It's important to note that these numbers are changing daily. You can type in the name of the nursing home and pull up the percentage of staff with a COVID vaccine, the percentage of the residents with a COVID vaccine, the number of COVID cases and deaths. Take a look at some of the numbers taken directly from the federal report. As of earlier today, Autumn Care of Portsmouth is listed as having 71% of residents vaccinated and 19.8% of staff vaccinated. The report also states that Autumn Care of Norfolk has 48.1% of residents vaccinated and 23.6% of staff vaccinated. The two locations are run by Sabre Healthcare Group. They have several facilities in our region. We asked them to confirm the numbers in the report, but they didn't respond. Previously issued us a statement saying each facility strongly encourages and recommends vaccination for staff and residents. We have the ability to offer vaccination through a partnership with CVS. Anyone wishing to be vaccinated can obtain a vaccine. We continue to work closely with the Department of Health and follow local, state, and federal guidelines and regulations. What do you think about their response?
I don't like that response.
Are you surprised by the amount of people that are vaccinated?
I'm very surprised. I would at least think that they would be the first ones to go ahead and do it, to cover not only themselves but the residents too.
News 3 reached out to organizations who fell below the national average. Two of them told us there were errors when entering the data, and they're working on fixing those issues.
It's hard for me to imagine how you could have such a low rate of vaccination. I don't know whether they're not recording appropriately or it's just the population they have.
Many have high rates of vaccinations, like Bayside of Pocosin Health and Rehab, who told us they have almost 100% of their staff and residents vaccinated.
We've been relentless as an organization, promoting the vaccine since it became available. And so, not all buildings are at 100%. They will be.
Trio Healthcare Senior Vice President Alan Crosby says his company made the vaccine easy to get, worked hard to educate their staff, and created a campaign called I Did It For.
We highlighted our people in our buildings that got the vaccine.
He says a small number of employees left because they didn't want to get the vaccine, and says some have been hesitant.
Listen, try to, understand their perspective, but at the end of the day, we've got to do what's right in our belief to take care of as many people as we can. And that's why we ultimately mandated the vaccine.
Experts say the fear of being understaffed or infringing on personal rights has prevented companies from previously requiring the vaccine. Dr. Oldfield believes those in nursing homes need to be protected.
How COVID gets into a facility is generally the staff. The staff get infected in the community, they bring it into the nursing home.
And says not getting it is dangerous.
And those unvaccinated are the ones that are ending up in the hospital, ending up in the intensive care unit, and potentially dying of COVID. Vaccination is absolutely critical.
Cheryl says she's constantly worried about her brother and offers some advice to others.
Just really check on your family. Just please check on, your family and make sure they're okay.
Making sure one of our most vulnerable populations is protected and properly cared for.
All right, so how can you find out if the facility where your loved one is staying, that the staff there is vaccinated?
Yes, well, we have a link on our website with the report. So you go on, you click the link, and then there's a place for you to click on again, and you can search the name of the nursing home through like an Excel sheet.
So what happens to these nursing homes who don't comply with these mandates?
Yeah, so the mandate's all in the works, and if they don't comply with the federal mandate when all the details are worked out, they could face losing federal funds.
Okay.
All right.
Thanks,
Thank you,
Margaret.
Margaret.